Good evening, everybody, and welcome back to RAMP, Real Access Motivates Progress, live Wednesday night podcast. I'm sorry that we haven't been here for the last couple of weeks, but I have been in and out of the hospital fighting COVID, but we are back in action tonight, and what a great show to be starting back with. Tonight, we'll be talking all about RIPIN, Rhode Island Parent Network information. And we are so excited to share everything that they do here and around Rhode Island. So welcome to the show.
Thanks.
Hi, everybody.
Thanks for having us.
Oh, I am so excited to learn everything about I know a lot what you guys do, but I cannot wait to let all of Rhode Island and everywhere know what you guys do. So let's get right into it tonight. And we're going to start with you, Mark. Tell us who you are and what you do for RIPIN.
Yeah, so my name is Mark Gray. My title at RIPIN is Communications and Community Engagement Manager. And so what I do is that I communicate all of RIPIN's programs, services, our message to promote our mission and our vision, and let everyone know all the ways that this organization can help the people of Rhode Island. We help people of every age, every ability, every background. And that's my job. It's a pretty sweet gig, actually. I get to travel all over the state, meet different people everywhere I go, and let them know how awesome this organization is.
That is awesome. And Rhode Island is such a beautiful state to travel around, not in the winter so much, but definitely in the spring and the summer. Tara, tell us a little bit about you and what your role is there at RIPIN.
Hi, everyone. I'm Tara Hayes. I am the Family Voices Manager at RIPIN. So I've been with RIPIN 11 years. I came to RIPIN after my oldest son, Andrew, was born. He had a lot of medical challenges, spent some time in the NICU, and I realized that my teaching career wasn't going to pan out. So I needed an organization to turn to and to help support other parents who had gone through some of the similar struggles that I had. And so as the Family Voices Manager, I helped to bring the family voice to the tables where people are advocating, where education is happening, where services are being discussed, where advocacy and empowerment happens for families. And we really just strive to give families the resources and the support that they need to be able to advocate for them, families and themselves.
And you do such a great job because we got to meet through some of the events that you go out and share your voice with. So it connected us. So you do a great job at what you do. Michaela, how about if you tell us a little bit about you and what you do at RIPIN?
Sure, thank you. So my name is Michaela Gardner-Higgins. I am the Clinical Care Manager for RIPIN's Care Management Program. I've been at RIPIN now. I just celebrated my 3rd year anniversary and started supporting our, what I call the OG Care Management Program, which started about 3.5 years ago. We're supporting individuals who are dually eligible, and we have a fabulous team of community health workers that help provide them care coordination. We also have a terrific clinical team filled with clinical social workers and nurse case managers that I'm able to help support as well. And in addition to the care management program, I've also been supporting our hospital care transitions initiative, which is just over a year old, and very excited to be part of those two programs. I started working with older adults. I'm afraid to say it was over 10 years ago, but I started as a Meals on Wheels volunteer and ended up here. I got my master's in social work and was a community geriatric case manager, worked at the state helping people transition out of nursing homes, and have landed here at RIPIN for similar reasons that Tara mentioned. You know, I feel like RIPIN is a place where you're home and you're surrounded by just incredible people who have incredible stories. And I'm very, very lucky to be here. I'm very happy to be here to share all the fun stuff that we do.
Oh, that's great. You guys, like I said, you guys do incredible work and people need to know more. Mark, I want to get a little bit more in depth with you. We're going to do RIPIN for Dummies. We're going to burrow it down to what is the main reason people would want to contact RIPIN? Like, what is the main source why people would want to contact RIPIN?
So you kind of heard a little bit of it just now from Tara and Michaela. So this is an organization that since our founding in 1991, we just celebrated our 30th anniversary year last year, has been built around a peer support, peer professional sort of model of helping people, meaning that the folks at RIPIN who are helping you are peers. They themselves have a child or a loved one, someone in their family, someone in their personal life who they had to help navigate these different complex systems because of their disability or because of their different needs that they might have. So looking at, you know, folks whose kids needed special education services, and that's the person that you're going to talk to if you call RIPIN. 9 times out of 10, that staff member is going to have lived sort of the same thing that we're helping walk you through. So I'll tell you a little bit about that history because it is pretty cool and pretty important. You had back in the early 90s, it was a big moment, you know, for disability rights, disability advocacy. And you had a group of parents here in Rhode Island who got together, who found that their children were not getting what they needed to be successful at school. And they kind of just banded together and helped each other, helped inform each other. You know, these are your rights. This is how you can advocate for your kiddo. These are the people you need to talk to when things aren't, you know, when you face barriers, this is how you push through them. And it really was just a dozen parents at first who formed what they called RIPIN, Rhode Island Parent Information Network. And that's really what it was. It was a network of parents who were supporting each other, informing and empowering each other when it came to special education. So you fast forward now 30 plus years, we still do all of that. And it's still focused around parents helping other parents. But now we help individuals and families of all ages throughout the entire life cycle, if you will, from early intervention programs for the little tots, all the way up to, like Michaela was speaking, the care management program that helps older adults of all different levels of ability and everybody in between. So that's kind of the thing that really sets us apart, is that peer model where we know that, you know, could somebody who doesn't have that firsthand experience help you and be as effective? Yeah, probably. But what our team brings is like just a level of empathy and understanding that you can only get from somebody who has that lived experience.
It's true. I totally agree with that because, you know, I always say nothing for us without us. Somebody can't tell me that something's wheelchair accessible and I can't get my chair into that bathroom that has that pretty little wheelchair symbol, but I don't fit. So the wheelchair symbol doesn't make it accessible. My chair tells you it doesn't work. So having that peer support in that model, I think, is so important because someone's going to believe somebody more who's going through that situation. And Tara, you go through that situation because you have a son who you had to help navigate through this system. How has that worked for you? And what some of the feedback do you get from like other parents? I'm sure it's amazing.
Yeah, so I think that, you know, when I first started at RIPIN, it was, you know, I was kind of naive in my parenthood. You know, my son was 3. We had just gotten out of early intervention. I had a lot of expertise from like going to college and being a teacher and a lot about the school systems and IEPs. But I now was starting to navigate this medical world, right? Like of Medicaid and Social Security and social systems. You know, I wanted to stay home with my son to learn how to take care of him. And as we know, you know, workforce is always an issue when it comes to serving people with disabilities. So, you know, you can't always rely on having a nurse or other support systems. So, you know, going through that myself and going from someone who was a college graduate, you know, living on my own, doing really well, to someone who's living back home, except taking on welfare, food stamps, and all that stuff was, you know, kind of a culture shock. But it humbled me and it helped me to realize like that even though, I am now in this different situation and I'm now taking this different journey, I can still try to make the best of it. And I can still try to find ways to help other families. And, during our 3 months in the NICU, that spark was already there. I was already helping other parents who were, sitting, their babies were next to me and they weren't able to be there because they were super preemies and they still had to work. And there was other things that were going on. And so I really transitioned that focus into supporting other families. And as I grew and as Andrew grew and he transitioned from early intervention into school, I said, all right, well, what am I going to do? And I thought about taking like a mom's hours job, like at a bank or something really simple. And that didn't feed my passion, right? I was like looking at things and I'm like, eh. And then I received this application about RIPIN, and it says one of the key things is you have to be a parent or a caregiver to a child with special needs to fit this role. And it was just perfect. As I stepped into the role at RIPIN, I met a lot more peers than I had of families with kids with special needs. I learned more about not just my story, but advocating as a community member, advocating for others who, may not have the voice or may not have the capabilities to do that. And now, I mean, we've had a successful support group that meets once a month for 9 years now. One of my colleagues and I co-facilitate that every month. And the parents that come, they say like, oh my God, I finally feel like somebody else gets it. I finally feel like I'm somewhere where I can just be accepted and be myself without having to worry about what others' perceptions are of me. And, you asked Mark, why would people call RIPIN? And in my mind, if you have a question and you're not sure of an answer and it has to do with something in your family life, call RIPIN. And I mean, if we can't help you, we'll direct you to somebody who can. And that's the beauty of us, being over 100 employees, is that, if we don't know it, if one of our colleagues don't know it, somebody else that we know knows it. Because in Rhode Island, if you know a guy, somebody knows a guy, right?
Everybody knows a guy in Rhode Island. It's
So-
like it
so
should
it's
be our
really-
motto, actually.
Yeah.
But it's so true because you get so many people who will say, the ADA is in place. How can someplace not be accessible, or how can that not happen? Or they don't really understand what we go through if you don't have that lived experience. And I get it, you know what I mean? And other parents get it, that you need to talk to somebody who's been there, who's seen it, who actually sees the down and dirty, the inaccessibleness, the barriers that are out there that we need to navigate around and find a way to get around it. So, I mean, it's incredible what you guys do. Michaela, let's talk about some of the transitioning that you do. I mean, I just got out of the hospital and transitioned home, and let me tell you, it was a nightmare. I had two other people in the room next to me who were much older than I was, and they were having them walk up and down the hallways and do exercise and transferring to chairs. But because I'm paralyzed from the waist down, they didn't let me use my wheelchair. They didn't even have a wheelchair in the room. They didn't have me transfer to it. Like all of the things that they were having the other ones do to see if they were okay to go home, they left me in bed for 2 weeks and didn't have me do any of that. So even in the healthcare system, they don't get it if they don't live it. They know all the technical terms or the idea of it, but because they don't live it, they don't get it. So tell me a little bit about how that works from your department.
Sure. So I'm happy to do that. I also, before I do, I'm going to get super mushy and toot Tara's horn a little bit more, because I'm a newer mom at RIPIN. I have an 18-month-old. And when I was pregnant with him, I remember one ultrasound talking about RIPIN, talking about where I worked and what the agency did. And someone saying, well, aren't you nervous? You're around folks who have children who have such significant needs. Aren't you worried about all the things that you see and what could happen? And it didn't even take me but a second to say, no, of course not. If anything were to happen, I have 100 people standing in my corner. Fortunately or unfortunately, our kiddo did need to spend some time in the NICU, but I had zero concern at any point because of who I had in my corner in my work family. So I'm very, very grateful for all the folks here. So thank you, Tara, and Sandra Rivera. She gets a shout out
Well,
here
just
too.
to say to that point, that is so true, because it takes the fear away, because it takes the unknown away. You've seen other parents go through it. You've seen other people go through it. You've already had that support network. So anything that you had to face at that point was okay, because you knew that there was somebody there that could identify and help you. So another great point of why RIPIN is amazing. So continue on now, Michaela.
Sure. So it was, as I mentioned earlier, I started my career working with older adults, and I cared for grandparents and was very honored and lucky enough to help one of my grandparents. I was old enough to understand and to see what was going on and to help with, getting her to the finish line. And seeing all the challenges that she faced, all the things that she would say to us, but you'd hear her say it to a healthcare professional, and the response back being, well, you need to do this. And yes, she did need to do certain things in order to reach a goal, but it was a big eye opener of how to sort of break things down and make things more manageable, because it is so overwhelming being in a hospital and experiencing that, and heaven forbid you're doing that alone without any family, without children. So that's sort of where I started, but the transition work that we do here in our HCTI program is very similar to that work that I did personally. And we have a fabulous team of community health workers that are working embedded in several of the hospitals in Rhode Island. And they get the cases that some of the hospital staff are just like, I'm just not sure what to do here. And they have totally embraced the network and the peer model that we have at RIPIN. And I'm very, very honored to hear and help with our weekly debriefs and hear the staff talk about, well, I have this patient and she has parking trouble at her home, and her caregivers, the home care agencies can't get there. They don't have any place to park. And that's what's holding up her discharge. And having the opportunity to help our community health worker worked with the town that this patient was living in to say, okay, can we allow for placards on this part of the street? Can we let's talk about some of the options that we might have to get this person home, and avoid having to go to a skilled nursing facility because they don't want to and they don't really need to. So it's an amazing program. All of our programs are just amazing, but it's really exciting to be able to do that work that nobody would think of. You talk about, you don't know it unless you live it. And if you told someone, well, this person is still in the hospital because there's nowhere for their nurse to park, it boggles so many people's minds. And it's a really wonderful program that we're able to solve those problems that nobody knew were actually there.
I'm going to ask a question. I'm going to let any one of you answer it because it was a lived experience for me. Now, here I am in the hospital by myself because obviously I'm in isolation because I have, the dreaded COVID. And I'm a heavy advocate. I mean, I work for the state and I'm a great advocate, but there was nobody in the hospital advocating for me. I asked every shift, every hospital, please at least put a wheelchair in my room for my mental stability, because to look over and not see that I have a way of getting out of this hospital and not dependent on anybody is mentally challenging, especially when you're in there alone. You can't have anybody, and the resources about sending me home. How does somebody get to RIPIN when they're in the hospital and they're feeling this? Can we call RIPIN from the hospital, or is there somebody that we should be asking for in the hospital?
So I can speak to that a little bit. Right now, our referrals come directly from our partners at the hospitals. So our hospital care transitions initiative, we don't have an opportunity to self-refer quite yet. But I will say we have wonderful relationships with our contacts at the hospital. And if we see someone or hear of someone who might benefit, then we can absolutely reach out and collaborate with our hospital partners to get that person looped in with the right supports. And if they are dually eligible or they do have Medicaid, there's some opportunity within our care management program that also supports some preventive work. And there are ways that we can help support that transition once they're home, making sure those right services are in place to make sure that they're able to stay home and they're able to remain independent at home.
Well, I'd love to work with you on that, to have another out, because I know there were several people like me in the hospital. My experience wasn't isolated. That I think we have great programs. We just need to do better and maybe, figure out another way of hearing our voices. Tara, how is it? I mean, hopefully your son never had to go to the hospital during COVID, but how is it as a parent, during COVID? Do you get to go with him, or how does a parent advocate whether they get to be with their child or not during times like this?
Yeah, so I do just want to quickly touch back on your last question, because I do want to say, not just for the older individuals, but for families or anybody who may be in the hospital that has questions. If you know about RIPIN, and you can always call our call center, and we have a health or an education option, and most of the time we try to answer those calls live during business hours, so that's always an option. And then for families who have young children in the PICU or the NICU, it still surprises me that every time we go in there, whether it's for a routine visit or not, I bring up RIPIN and they're like, oh, what's that, and so just bringing more awareness around that. The NICU, more people know about us there because we used to have peers that worked there. But I always would encourage families, you can always reach out to RIPIN if you know about us and, and you're having some issues. I personally have helped some families who've had challenges getting home because they didn't have nursing care for their kids. And if they don't have around the clock care because their kid is trached or vented or whatever, they don't want to let them come home, but that's not an appropriate, type of response to keep the kid in the hospital. So there's things that we can do to support those families and individuals. But in response to with Andrew and COVID, so we were really fortunate. My home care nurses still came. They were fine. I was fine with them coming. They were fine with coming because we only have 2 of them, and the days that they come, they're not with any other clients. We did, unfortunately, right after the new year, catch COVID, all of us. Andrew is on a vent. He is trached. He luckily has strong lungs and is very strong. So we didn't have to access the hospital or any additional, really besides his typical sick plan with some extra suctioning and cough assist machine and stuff like that. We did end up having a couple of virtual visits with doctors, which was really helpful to have that virtual option. And working at RIPIN, we easily transitioned to working at home because many of our staff were working out in the community or working at, host sites or, had a laptop and had the capability to do that. So we were really lucky to be able to quickly transition to working at home. And even though we had our challenges with constantly being in the house and the kids home and distance learning, everybody just kind of understood, especially our executive director who has 3 young kids himself. So he knows, he gets it. And it just made us feel that much more at ease because we knew that we were allowed to put our family first and not our job. And I think that helped us to support more families than we ever did because we were just able to have more conversations and flex our time and meet families where they were at. We did end up sick. We were fortunate to stay home. And actually, he did have a hospital visit that it was routine. And I am able to go with him. You can bring one parent if the child is under 18. And most of the visits, I would have my nurse with me. So I would be like, is it okay if the nurse comes in? And they were accommodating to that. The doctors that we see and the places that we had to go. So we stayed home as much as we could. And we just kind of worked through it as a family.
I think one of the best things that came out of COVID was the virtual doctor's appointments, because let me tell you, that is key, especially when you have to navigate a wheelchair and a lot of places aren't accessible or it's a grace of God to get in there. I think that's one of the best things that has ever happened, especially when you're going in for something like that would take 2 seconds and like, really, I came all the way down here, waited in the waiting room for this, like it wasn't worth it. Mark, tell me some of the other positives that you saw come out of COVID that actually benefited and helped your goal at RIPIN.
So yeah, the virtual visits is a big one, and that's actually, as a result, we have kind of a pilot program that we're doing at RIPIN, where we have a certified community health worker who, for older adults who want to do that telemedicine, that virtual medicine, but they don't have the technological sort of know-how. They don't maybe even have the equipment. Our certified community health worker will actually go to that person, meet them at their home or in the community, wherever they're comfortable, and help them make that telemedicine appointment, help them access it. We will bring I think they bring either like a tablet or a laptop. We'll bring headphones. We'll help you log on to the meeting. We'll let you have your medical appointment in private, of course, but we'll also stay on hand in case something goes wrong to troubleshoot. And this is it's a pilot program. We're testing it out, but it's available to pretty much any senior in Rhode Island who, maybe there's a big risk, right, where with COVID and the fear of catching it, that you're now not going to go out and get the medical care that you really need. And so the telemedicine really allows folks to bridge that. But if you don't have the technology, then that's a barrier. So we're breaking down that barrier. And that's one really cool thing that has come out of all this. And I'll just, to go back to the call center that we touched on, first of all, the phone number for it is 401-270-0101. You can call this number and access all the stuff that we're talking about. We tend to, like, as nonprofit folks, and nonprofit folks who are listening will get this, like, we think of our organizations as these collections of programs and services and whatnot. As the person who calls us looking for assistance, don't worry about what the program is or what the, acronym is. Just give us a call, because our call center is, like I said, staffed by these peer professionals who, if there's any way at all we can help you, we'll figure out how. We'll connect you to the right person. One way that we do that, big thing that we've been doing at RIPIN for almost 10 years now, I think, is the health insurance consumer assistance work. So you're talking about, being in the hospital, you're talking about accessing medical care, whatever it might be. And all that really comes back to, a lot of times, the insurance. Our team is able to help troubleshoot those insurance issues that come up. Everybody knows somebody who's had a problem with their coverage, whether it's Medicaid, Medicare, dual Medicaid, Medicare, commercial insurance, whether you get it through your employer, whether you get it from Health Source RI. Health insurance is complicated, it's complex. The customer, the consumer, doesn't always even know what's covered or how to use it. And our call center is actually set up to answer those questions. Everything from basic questions like they're telling me in-network is one price and out-of-network is another price. How do I even know what in-network means or who's in-network? Simple questions like that we can usually answer in, maybe like a 10-minute phone call, all the way up to those really complicated cases that you hear about where your doctor maybe says, I want you to go for this procedure or go see this specialist. And you try to go do that, and your insurance is like, no, we're not going to cover that. Or, you can't go to that doctor, you got to go to this doctor, and that doctor is booked, 18 months out, so you're just going to have to wait. Our team is able to, a lot of times, help people navigate those barriers, because you have things like rights to appeal different decisions that your insurance company might make. That appeals process is often very complex. We've been able to walk consumers through that process from beginning to end, get them the result that they need in terms of getting access to the care that they need, or a lot of times getting things covered and paid for that they should have paid for, getting bills that should never have been sent to the consumer, taken care of. We've actually saved or returned something like $5 million to Rhode Island consumers over the last 5 years or so in healthcare costs that they never should have had to pay. So that's a huge thing that we do that not enough people realize we do. And it's for any Rhode Islander, no matter what insurance you have, no matter what type of coverage you have, this program is open to you. It's open to the whole state. So that's another really cool thing that we do.
And that's huge. One thing I will say to everybody, if it's an actual emergency where you can't breathe or you have something, go to the hospital and get treated. Worry about the insurance later. There is always a way that it will be fixed. Do not wait to call your insurance company because you're trying to get this, and you don't know. Just go to the hospital, get your treatment, and then call RIPIN and have them walk you through how to fix it. Because there's always a way to fix it, but they cannot turn you away at the hospital for an actual emergency. Don't go with a stubbed toe, or a broken toenail. I mean, like an actual emergency with trouble breathing or a broken bone or something. Get treated and then worry about the insurance afterwards. But according to all of these tests, there's always a way around it. And RIPIN, like Mark said, is great at walking you through that. That is one thing that they excel at. Because I've actually used them to get around because one doctor sent me to another doctor and I just went because to me it was an emergency and they got that all figured out for me, whatever. So RIPIN, this is why RIPIN is so important and why more and more people need to know what RIPIN does, because you're getting peer support. So you're talking to somebody who's been through it. You're talking to people who navigate the insurance things on a daily basis. You're talking to people who transfer you from hospital or nursing home to nursing home on a daily basis. You're talking to experts here. They may not call themselves experts. I call them experts. They deal with this on a day-to-day basis. They live this experience on a day-to-day basis. If you don't like the person you're talking to, because let's face it, everybody doesn't mesh. You may talk to one person that you just don't mesh with. Hang up, call back, and talk to somebody else. And you will find somebody that you mesh with, because there's not two people in the office. There is a slew of people. If you can't find somebody you mesh with, even can, just somewhat civilly talk to one another, it's not RIPIN, it's you. So fix it, because they're going to help you. So I'm being honest. If you get nothing else from me, you get straightforward honestness. But like I said, there's been more times when someone's having an off day and I hang up the phone and call back and got somebody else and fix my problem. So there's always a way through it. Complaining, putting it off, or, saying I didn't like this one person. Too bad. Call back. You will find somebody. All right, Mark, give us your main goal at RIPIN.
My main goal at RIPIN?
Your main goal, like what you want to happen with RIPIN.
I want every Rhode Islander to know that RIPIN is here for the first part and what we can help them with, because, like a lot of nonprofit organizations, we get grant funding to do all these excellent programs and services, but most of the money goes to the doing it and not the advertising it and the talking about it. So that's why I appreciate opportunities like this to come on your podcast and share this, because that is my number one mission at RIPIN, is first of all, make sure everybody knows that we're here and what we can do to help. And what we can do to help is, again, through that call center, and I'll say it again, 401-270-0101. You can call this number. If you call during business hours, 9 times out of 10, you're going to get a live answer. If you call after hours and leave a voicemail, someone will call you back within 2 business days. If you send us an email at info@ripin.org, someone will reply to that email within 2 business days and start working your case. We can help you with everything from, if you are a parent, you've got a child who has a disability and you're trying to figure out what that even means for you. You don't know where to start. That's a great time to call RIPIN. If they're a young kiddo, we'll get them in early intervention. If they're school age, we will help you figure out everything with special education. The thing that all these things have in common, Tina, is they're complex systems. The systems have been set up and built up over the years and not necessarily designed for the end user. And so it could be very opaque. It could be very difficult to navigate. That's the thing that these have in common. And that's what RIPIN is able to kind of cut through those barriers. And yeah, it's a complex system, but we're going to give you the skills and the tools and the knowledge you need to understand that complex system and help it actually work for you and your family and your child. So special education, give us a call. We can help you walk through the ins and outs of all that. Healthcare, health insurance, Like I said, give us a call. Older adults, you know, we have lots of different programs. One big one that we've been doing for a few years now is the Community Health Network. So these are evidence-based wellness programs that we help coordinate throughout the entire state. Most of them right now are still virtual, but they're starting to come back in person. When they're in person, they're in really highly accessible places like libraries and senior centers and community centers. And most of them are totally free. Some of them might have a low cost. Sometimes that cost could be absorbed by your insurance coverage. But these are things like diabetes prevention program, diabetes self-management program, chronic pain self-management program. We have smoking cessation programs. There's a bunch more that I'm blanking on, but they're basically, the thing they have in common is they're all evidence-based. They're all tested. These aren't just like, you know, someone in front of a room telling you to like eat more vegetables. This is like a little bit deeper than that. It's been shown to work. It's evidence-based. All the instructors are certified. So that's the Community Health Network that we help coordinate. And if you go to ripin.org/CHN for Community Health Network, ripin.org/CHN, that's going to list all those programs. You can sign up right on the website, find a program that's near you, or find, like we're talking about, a virtual program where you can take advantage of this just right from the comfort of your own home. And so like that's, I guess, to answer your question, that's my number one mission, is let you know that RIPIN is here, let you know that you can connect with us. And if anything that we're talking about here today makes you think, gosh, you know, I have this issue, but they didn't quite mention that, so I don't know if they can help me, just give us a call. Because if we can't help you, we'll figure it out within, 5 minutes. And then in the next 5 minutes, connect you to somebody who can help you. But it's amazing what our call center team has been able to do, because they do this all day, every day, because they're peers. They are often aware of things that are happening in the state, opportunities and things that people can take advantage of to help them live a healthier or better life. They're often aware of stuff that you or I haven't even heard of. And I know you're plugged in, Tina. You know, like 99% of what's going on. And it's kind of amazing to me whenever that call center knows like that 1% thing. And I'm like, oh, I had no idea that existed. And they're like, oh yeah, I refer people to this all the time. So takeaway from me is just call the number 401-270-0101 and see if we can help you out.
Yeah, I mean, RIPIN is great. And like I said, I'm such a huge advocate. And you're right. I learn something new every day. Something I'm like, really, we do that? Or the state has that? Like, how did I not know about that? And I am plugged in. But when you just find out that your child is diagnosed with some rare disorder or some sickness, or you're older adult and you don't know what to do, just pick up the phone. There is no dumb question. There is no stupid question. And you know what? The question you have, somebody else has that question. So you may be getting an answer for you, but you're also answering it for a lot of other people as well. So there is no harm, no foul on picking up the phone and asking and finding out from there, because you might find out a lot of information that you never knew. I'm sorry, I didn't mean to interrupt you, Michaela. So
no, I just sort of reiterating the sentiment. I think we sort of look to systems sometimes as being barriers, but what I love about what RIPIN does is look beyond those systems sometimes. And I always say our community health workers look under every rock and every bush, and they will bridge together resources from the far corners of Rhode Island to try to make sure that somebody gets what they need. And they really bridge those resources together to meet for that one individual. And it's truly amazing. It's very inspiring to see, as Mark mentioned, all the things that our staff know about, they learn about, and they're living, because those resources are being built in their communities. So they hear about them because they're a part of them.
And one thing I want to throw out there to everybody is disability is not a negative word. Having lived in a wheelchair, please don't apologize to somebody because they live in a wheelchair, because I'm telling you, I'm living my best life. I get to wear a shiny crown. I just won a pageant about all women who walk. I've gone surfing. I've gone rock climbing. I am out and about. I'm living my best life. So disability is not a sad thing. So if you find out your child may have a condition or something, it is not the end of the world. It's just a new way to navigate. And let me tell you, what a blessing it is to watch that child strive and hit milestones that people told you that they were never going to hit. Because I'll tell you, people were told me that I was going to be a vegetable in my wheelchair and really not do anything. I was swinging a sledgehammer last summer, building my own home, and painting ceilings and walls. So never let anybody tell you you can't do anything, and it's not a negative thing. So get rid of the negative, go to the positive, and go to the source. Go to the experts. Call RIPIN, because they will guide you and they will give you the most positive outlook. And you will feel empowered and you will feel better, and you will know that it's not a negative thing. It's not a bad thing. It's just a different thing. It's just a different way of navigating the world. And Tara, I know you can speak to that, because watching your son to strive and thrive through his whole life. What is his goal? What is your goal?
So I guess there's a couple things. One thing I do want to say is that even though we're the Rhode Island Parent Information Network, a lot of times people are like, well, I'm not a parent, or I'm not, my child doesn't have special needs. That doesn't mean that we can't help you. It was based on 30 years ago, like Mark said, the parents who got together, and yes, at that point they were parents and they were helping families with kids with disabilities, but we've grown to be so much more. And I think that, as Andrew has grown and navigated this world, he's now 14. We always just said, and I was fortunate, my mom is a special educator. I was a special educator. I've always had individuals with disabilities in my life, surrounded by me, like, whether it was doing respite care or volunteering with Special Olympics. And so it was just a different journey for me. Like you said, like we just changed our journey. And so we've always looked to him to say, okay, your disability doesn't define you. It's not who you are. You are going to show us what you're going to do. And that's what I always say to other parents. Like, you just have to trust your mom instinct, your dad instinct, trust yourself as a parent in knowing what's right for your child, or knowing what's right for the person that you're caring for, because 9 times out of 10, your gut instinct is going to be the right one. And what's best for that person that you are caring for, almost 24 hours a day. And so just really showing parents that even though, you were told that they, wouldn't have a quality of life or may not live past so long, you just have to have faith and, and do what's best for your family or your child or your loved one, and let them kind of guide how their trajectory is going to go in life. Because anytime you put limitations on someone, they're going to be bound by those limitations. And we don't want that. We want, people to be able to grow to their full potential.
If we all did the same thing and we all hit the same milestone at the same time, what a boring world this would be. What a great experience it is to have somebody with disability in your life and, see a different way of doing things and see, how they strive and go. But like I said, if we all did the same thing at the same time, what a boring world this would literally be. We were built on a world of differences and a life of differences. Embrace it. And you may not have a child or know a parent or a grandparent right now that has a disability. So learn something new, open your horizon and go meet one. Because I'm telling you, if you don't know one, you should know one, because I'll tell you, it will change your world to know one. So go out of your way and volunteer at RIPIN, get in part of their programs and meet some very amazing people. I'll tell you, it'll give you a whole new outlook on your normal, long, boring life. When you meet somebody new and doing something different, you're going to try to compete with them. So get out there and learn somebody new. Michaela, give us your goal.
I probably share, the goals of Mark and Tara. I think we're very lucky enough to have an all staff meeting a few months ago where that was kind of asked of us as employees. What do you see in RIPIN? What do you see as the vision? And I think we all just wanted people to know about us, that it was important that even the simplest question, what you feel as though is a simple question, just reach out to us, because we've got an opportunity and we've got access to so much information that is going to give you 10 times as more information that you thought you wanted or needed, and 10 times larger of an answer for that one simple question that you feel as though you're going to need to ask. And it's, I think it's important for us to continue to find ways to make programs more accessible to individuals, and make folks continue to give individuals the opportunity to understand these programs, because they do feel so complicated from the outside. And we've had great partnerships with Department of Human Services and EOHHS and our hospital partners, and had wonderful opportunities to offer a lending hand and say, hey, we've got these community health workers that can do this, and they can do it really well, and they can meet patients where they're at, and they can help get individuals what they need. And, you know, I think over the past couple of years, just access to state programs has been so challenging for folks. And we can really help with that. We can speak the lingo. We can bridge those communication gaps if they're happening. So really, just everybody should know about RIPIN. And if we can't help you, we're gonna find somebody who we know can.
And I just would like to add that that it's just, you know, another main goal, and I guess one of the biggest ones is for families and individuals to just feel supported, not to feel alone. If they're having challenges, if they're having transitions in their life that they're not sure where to turn, there's somebody who can support you. You know, not everybody has family or friends close by or somebody that they can turn to. And even though we may not be, you know, your next door neighbor, we're still, you know, a Rhode Islander just like you, and we're still, you know, family members. And as National Family Voices says, 1 in 5 families is touched by an individual with special needs. So look around you, you know, we're all out there, we're all experiencing different life journeys. And even though a lot of them may have different paths, they intersect a lot at different places. So, you know, we've all had to navigate health insurance systems. We've all had to navigate, you know, education systems at some point in our lives. And so, you know, there is somebody out there who will understand and will try to support you.
And we are very fortunate that we do live in Rhode Island, because you can go end to end to the state in 45 minutes, and that's what sightseeing. So we are all neighbors because we all live that close. When you talk about other states that, you know, it's 3 hours just to get to the next county, we're very fortunate to live in Rhode Island, that all of these resources are within a 45-minute travel time. Mark, give us the website and the phone number again.
All right, so the phone number is 401-270-0101. Again, give us a call after hours, leave a voicemail, call during the day, you'll get a live answer. Visit www.ripin.org to see, you know, everything that we do, basically. You'll find on there menus with they say how to help, how we help, how to get help, lists all the different programs. And again, if you don't know what it is you need, just reach out, just give us a call. Can't call, don't want to call, send us an email, info@ripin.org. And if you see different phone numbers on the website or different email addresses and you're not sure which one's the right one, none of them are the wrong one. There's no wrong door at RIPIN. Send that email to whatever address you think, and we will make sure it gets to the right person. One thing I want to touch on really quickly, because I hadn't mentioned it yet, but it's a big part of what we do is, you know, Michaela's talked about the care management we do for older adults who qualify, for parents of children who have a disability or one or more chronic conditions or at risk of developing a chronic condition, and they're eligible for Medicaid. We do care coordination services for them through what's called the Cedar Family Center. You might have heard of these. There used to be a bunch of them, but now we're like one of the last two. But it's huge because you've got a kiddo in that situation where they're seeing multiple specialists. They need a bunch of different therapists and different services, and you don't know where to start. Our team and the Cedar Family Center, they do care coordination for all of that, help you find the right doctors, stay on top of your kiddo's medical and other needs, and connect you with the services, wraparound services that are going to help that child thrive. So that's our Cedar Center. Again, 401-270-0101. And if there's anything we can do to help you, we will. And I'll say real quick too, we spoke a lot about the kind of work environment at RIPIN, how it is very supportive and how it is a very flexible and understanding kind of workplace. If that sounds like the place you'd like to work, we are hiring. We have several open positions, and you can find those on our website as well, ripin.org/careers, and apply for those jobs right online. And if you're a peer, think about peer in the broadest sense, because everybody, like Tara said, everybody has somebody, almost everybody has somebody in their life who is touched by a disability or special need. And so, yeah, just check us out. We might be the right career for you.
And if you don't remember www.ripin.org or the phone number, you can always contact me, because I bug these people on a daily basis, so I can help you bug them. So contact me and I will give you all of their numbers and information and their personal emails if you really want them. I can hand them out. So I will make one of all of your goals come true. The word is out about RIPIN. If you are not connected or you don't need the services right now, please share this podcast, because the best information is information. So share this podcast far and wide, because you never know who on your friends list needs to know this information or will need to know this information at some point. So share this podcast, share this information, go to ripin.org, call the phone number, ask in the hospitals, or contact me. You have no excuse of how not to contact these amazing people and friends of mine at any point. So make sure you're contacting them. Again, it's www.ripin.org and the phone number. Thank you all for taking the time tonight to be part of our show tonight. I am so excited to get this information out there, and we will be sharing this on LinkedIn, Twitter, Instagram, Facebook, and any other social media that you can think of. We're there. Go to RAMP, Real Access Motivates Progress. RAMP is inclusion.com, or the Coalition Talk Radio, and you can find this podcast anywhere, or just share it. Because if you're watching this beautiful face and all of these other beautiful faces, just share it. Hit the little share button. It takes 2 seconds. It costs nothing. And you could be saving a life or helping somebody that you don't know. So thank you so much for taking the time tonight to be part of our podcast. It was such a wonderful back to getting to podcasting. What a great show this was tonight. So thank you all so much.
Thank you, Tina.
Thank you.
Thank you for having us.
Oh, anytime. And I would just like to invite everybody back next week, because next week we have a special show. We will have our Lieutenant Governor, Sabina Matos, and our Secretary of Commerce, Stephen Pryor, on our show next week, talking about how to help businesses become ADA compliant and allow more people into your business. Think about it. If you allow more people in, you raise your bottom line, because they never come alone. They always come with a ton of people. So why not open your business up, take part of these tax breaks and all of this information that you can, and open your business up to more and more people. So join us next week, next Wednesday night at 7 o'clock for our Lieutenant Governor, Sabina Matos, and our Secretary of Commerce, Stephen Pryor. And as I always say, don't just sit there, make a difference. See you next week. Have a good night.